Well, hello. My name is Nilofer Azad, and I am a medical oncologist here at Johns Hopkins University at the Sidney Kimmel Comprehensive Cancer Center. I have been focused on taking care of patients with colorectal cancer for the last 15 years, and I'm very happy to be here today with Cancer Nursing Today as a roundtable to focus on colorectal cancer with two of my colleagues, Rachel Klein, who's a nurse practitioner who works at Johns Hopkins as well, and Fatemeh Youssefi, who is also here representing nursing that takes care of colorectal cancer. The other side effect that I think is relatively unique to our drugs or people who get EGFR inhibitors is the EGFR inhibitor rash that both of you have spoken really eloquently about. I tell patients it's a wicked rash, like the worst rash an 18-year-old kid with acne got. But we do have some data that you can do prevention, and so you can do that with starting patients on doxycycline preventative. So you do that even before they start the EGFR inhibitor, and then you use emollients at night and sunscreen in the morning. And so, those are pretty unique to the drugs that we use, have all the same, drug side effects that other cancers have too, right? So nausea, diarrhea, counts falling. You all spoke nicely about some of the things we can do there. If either of you have any particular tricks for refractory nausea, refractory diarrhea, this would be a great time to share because sometimes we have something squirreled up our sleeve that works for our patients that we really struggle with. Anything you'd like to share?
One of the things that among the herbs and all the spices that really has been evidence-based per honest always talk about that is a ginger. So I think occasionally patients can benefit. Of course, it's not as replacements for the antiemetic regimen that needs to be done, but ginger tea, it sometimes helps patients, and that's evidence-based. Otherwise, everything else is just a gadget to make sure that there are prophylactic, they are aware of their symptoms. They know as when to start taking their nausea medicine. Sometimes patients don't want to take extra medicine adding to it, but to understand that why they get steroids, dexamethasone for 3 days, and they have ondansetron and they have propofol, and these are all attacking different receptors basically, and to educate patients again to understand as why they need to take these combinations, if you will.
Yeah. Rachel, any particular regimen or drug that you like for patients that have some refractory symptoms that affect their quality of life?
I do. I think one of our most potentially underutilized drug is olanzapine. It is in a similar.
Just thinking that too.
Yeah. It's in some institutions they use the brand name would be Zyprexa. In some institutions they use this in higher doses for several days around the time of chemotherapy. In our institution, we use an IV form of an H3 blocker that's it's H3 that's Emend or fosaprepitant, and so we don't always use the Zyprexa up front. But there has been some really compelling palliative care data recently that olanzapine in small doses every evening, like 2.5 milligrams to 5 milligrams, can not only help with nausea, but also appetite improvement. And actually even better than mirtazapine or Remeron, which has been kind of a preferred drug for a long time for improving appetite. But the palliative care community, I think, is leaning more towards olanzapine now. So that's been a go-to for me. I find that in low doses, people don't have drowsiness, but if taken in the evening, it may help reduce anxiety and help them sleep. So I just think it has a lot of benefits that we can kind of help with a lot, some co-occurring symptoms. And then also for low grade kind of chronic nausea, I'm a huge fan of C-bands or like wristbands that have an acupressure point, goes right here. They're really not invasive. You know, they can be used. A lot of times people don't want to add more side effects of more drugs, or just don't want to pick up something else and take another pill. And so if they, especially actually on Lonsurf, I find, because you're taking it twice a day, you may not want to take a nausea medicine twice a day. Those C-bands, those acupressure wristbands have been very, very helpful for a lot of our patients who have that low level chronic nausea kind of for several days in a row.
Well, I think this has been a great conversation. It's been such an interesting and exciting era in the last couple of years in terms of the options that have opened up for our patients, both in terms of treatment options, but I also think some of the supportive care therapies that have really come forward. And so I just really want to thank the two of you for your time. And I want to thank Cancer Nursing Today for inviting us to be able to talk about how we like to take care of our patients. So thank you very much.